As advances in technology and communication deepen the pool of knowledge about public policy, and globalization facilitates the connection between different regions, what can an external funder do to help countries in sub-Saharan Africa make the best use of information about health policy implementation in other countries? Based on their research, Oxford Policy Management have developed a recommendation for external funders looking to invest in this goal. While there is clearly no simple, risk-free option available, there are potentially attractive opportunities that are unlikely to be funded by low-income governments themselves. The recommendation comes in two parts. The first focuses on building the capacity of national institutions to engage with the international evidence base and facilitate its use by national policy stakeholders. The second centers on linking these institutions together through an international Pan-African Secretariat. Both of these components should be done through strengthening already existing institutions. There is no need to create anything new. The recommendation's first part is the national component, the creation of nationally hosted partnerships. Each nationally hosted partnership should consist of at least 3 parties: a national host, such as a local public health institute or a think tank, an international partner, such as a university department with experience in knowledge brokerage and the international health systems evidence base, and key national policy stakeholders like staff from the Ministry of Health or other institutions in health system management. Nationally hosted partnerships should be given funding for key knowledge brokerage activities such as rapid response, a quick answer usually to a politician's questions, rapid review, a more in-depth answer, perhaps to a civil servant's question, the facilitation of policy dialogues, enabling private discussions in a safe space, facilitating the use of existing platforms, helping to navigate the complex world of information services such as networks, databases, and communities of practice, and the production of health system assessment reports such as health in transition reports. This is about helping national policy stakeholders access and use information about the experiences of other countries and building the capacity of national institutions to deliver these knowledge brokerage services in the long run. The second part of the recommendation is to fund an institution to host an international secretariat that would act as glue between the nationally hosted partnerships. Key activities could include the facilitation of international policy dialogues and the commissioning of health systems analysis of international interest. A number of existing institutions could play this role. For example, institutions that have continent-wide coverage and mandate, such as the African Development Bank, the African Union, and the World Health Organization Africa Regional Office, or a collaboration of sub-regional health or economic networks. In the long run, we hope this strategic intervention has the potential to provide a key service to policy stakeholders and will improve the efficiency of information flow between countries in sub-Saharan Africa and beyond. Through Oxford Policy Management's recommendation, external funders can play an important role in building better health systems and healthier populations throughout the continent.